So thank you for joining me again and us, Wakana distributors and guests. I know you've invited guests as well, but I want to give Dr. Joseph Rosado his proper introduction. I introduced you, but you fell off, but you're back. So now they can see your face. But this is my colleague. He practices primary care medicine in Orlando. He is the medical director for 4 federally qualified clinics there, as well as he is a certifying physician for the medical cannabis program in Orlando, in Florida. So I want to let you know that I met Dr. Joseph Rosado, I think like 2 years ago, through the Minorities for Medical Marijuana, that organization that's really advocating for cannabis and its ability to be utilized in all avenues, be open to those of color, Black and brown communities and Latina communities. And so we have been really very good friends since I think 2.5 years ago. So tonight, I really wanted Dr. Joseph Rosado, Dr. Joe, Dr. J, Dr. J.
No, not Dr. J. That's that's somebody greater than me.
That's right. So we just want Dr. Joseph we're going to have a candid conversation about pain, because we know that's one of the #1 reasons that folks utilize cannabis. They utilize CBD, and it's for pain. So we're going to talk about pain tonight. We're going to talk about our relief pack. We're going to talk about all different ways to consume CBD. And we're going to talk about why it's so important that this information that you hear tonight is shared with your friends, your family, your co-workers, everyone you know, because I told them, Dr. Joseph, at some time or another, we're all in pain, right? And no one has time to take Tylenol or Motrin, all of those over-the-counter medications that we really think are benign, but long-term use, we know, causes damage to our kidneys, causes damage to our liver, and we have a plant that we can utilize that will give us the relief without all the complications.
Exactly. Like I told the young lady today, we hired a new nurse practitioner at one of our facilities. And so I've been mentoring her and getting her ready for her to be, flying solo. And we had a young lady come in as a new patient, and, they're going through the typical new patient questionnaire, do you smoke, do you drink, when was your last menstrual period, et cetera, et cetera, et cetera. And when they asked her, do you smoke? And she said, yes. And then they said, tobacco, cigarettes? And she said, no. And then she looked at both of us and put her head down. You could see the fear. And we looked at each other, because the nurse practitioner knows, what I do on the side. And we started laughing. And she said, what are you guys laughing about? And then I said, so you use your medicine, right? And she's like, yeah, it's medicine. I said, yeah, it's God's medicine. It's a freaking plant. And she's like, yeah. And so I said, here's my card. Do you have, because I said, do you have a medical cannabis card in the state yet? Saying, no, I got a 2.5-year-old daughter. I'm afraid that if I get caught, because people always tell me, I'm a mom. How could you be using marijuana? And I said, well, here's my card, so you can get your medical cannabis card and be legal. And then when they ask you, how can you, a mom, be using medical marijuana? You can tell them, because I am a mom, I have to use medical marijuana.
Right. And you know what? That is our vision here at Wakana, and that is to end the negative stigma. Because the negative stigma from the cannabis plant has truly caused us to lose out on our health. We lose out on wealth benefits as well. And so that's why our message is so important, that we get it out here at Wakana, that we educate, that we empower, and we have forums like this. So let's talk about all of the different types of pain, because there are many types of pain, right?
Mm-hmm. Oh, yeah. They list 5 types of pain, but within each one of those levels, there are sub-levels. The most common is what's called acute pain. You know, you're hanging up a picture or you're doing something and you hammer your thumb, that's acute pain. Acute means it happened right now. It's fresh. And the time lapse or the time frame for having acute pain is anywhere between seconds to 3 months on average. Some literature, some authors extend it to up to 6 months. Others say that between 3 and 6 months is subchronic pain, but acute pain is just that. It's an acute pain, it's an acute injury. You were involved in an automobile accident, boom, that's acute pain. You're having pain right now because we can pinpoint an actual injury or something that happened that caused that pain to happen right now. So that's the acute pain phase. And many people in the cannabis industry misinform the world by stating that cannabis is not good for acute pain. And I'm like, wait a minute, pain is pain. How could it be not good for acute pain? Because I've had, and I'm sure you as well, have had many patients that have had a tooth abscess, have had a tooth extraction. They've been given hydrocodone or oxycodone to manage their pain. They don't want to take that. They use their cannabis, and their pain level has been managed and or controlled. That you can't get more acute than having a tooth pulled. Now, with your, you being an OBGYN after doing a C-section,
Right.
what's been your experience as an OBGYN following a C-section or natural, vaginal delivery with,
Well,
using cannabis for pain?
Well, what's interesting is that we've had a patient that was not able to get their epidural before their vaginal delivery. And they utilized our topical extreme pain cream on their abdomen because they weren't able to get an epidural. And it was very effective and it worked for that patient, and they delivered and they continue to use that postpartum. So even topical has been utilized. And the same thing happens post C-section. Post C-section, we use a PCA where the patient can give themselves their own morphine. But when they go home, many patients don't want to use Tylenol #3. They don't want to use Vicodin. They don't want to use some of these opioids that could potentially cause them to become addicted. So they've utilized CBD, they've utilized tinctures, they've utilized gummies, they've even utilized topicals to control their pain. And I think that is really one of the fears of so many during this opioid epidemic. People don't want to potentially get hooked on these medications. So yes, it's been very effective.
Now, one question I get all over the world. I've traveled the world, as you know, and I've taught cannabis all over the world, and I've sold my book all over the world, which we'll talk about later. But one question that comes up is, if I'm lactating, can I use medical cannabis? Now, you just said something very, very interesting. They have delivered in the hospital. They go home. In the hospital, they have a pump to use morphine. They go home with Tylenol 3 or Tylenol #4 or hydrocodone or oxycodone, which is passed through the breast milk to the baby, and that is okay. But God forbid they tell their provider, no, I'm going to use cannabis instead of that. Well, that's gonna affect your baby. That's gonna go through your breast milk and affect your baby. Yes, it will, because your breast milk produces or has anandamide in it. It has an endocannabinoid. And by doing breastfeeding and giving the child your breast milk, the first thing that they receive is colostrum, but afterwards they're going to be getting endocannabinoids from the mother to go to the infant and stimulate their endocannabinoid system. So yeah, it is going to stimulate and affect the child in a positive direction. It's not going to make an addict, one more client for big pharma.
Absolutely. And that is a very, very big question. And for me, I practice in the inner city of Chicago, and 99% of our patients, when they come into labor, are positive for THC. I mean, they're already using it. But what's scary is that we don't know where they're getting it from.
Exactly.
So that's why people say, you're a cannabis advocate, you're part of a CBD company, and you're an OB-GYN, you're a medical doctor. What? Yes, I would want my patients to get a product that's tested, a product that works, a product that's safe, and a product I know where my patients are getting it from. So, yeah.
Exactly. So that's acute pain. Acute pain means pain right now, from now to about 3 to 6 months, depending on the book that you're reading. Following acute pain is chronic pain, and that's pain that lasts 3 to 6 months on, and that can last for years. The classic example of that is fibromyalgia pain. And for years, people have been, again, mistreated, misinformed to treat their fibromyalgia pain with opiates, where if you read the literature, you realize that the use of opiates, narcotics, whether it's hydrocodone, oxycodone, oxymorphone, hydromorphone, none of that works on fibromyalgia pain. The criteria, the American Academy of Rheumatology recommends the use of an antidepressant that's an SNRI or a mixed SNRIs. It's a serotonin norepinephrine reuptake inhibitor. The three most common ones are Effexor, Cymbalta, and Pristique, together with Lyrica. And then for bedtime, to help them sleep, they give them amitriptyline or Elavil, which helps with the pain and helps with their sleep. That is what is the treatment of choice per the guidelines. By incorporating some cannabis to that in different modes of administration, we're going to be hitting the different modes of administration here shortly, that come in the pack. But by incorporating and adding the CBD, which helps with the inflammation, which helps with the anxiety, which helps with the insomnia, all of those things in conjunction together, yes, you may want to start your patients with the conventional treatment and incorporate the cannabis, and then little by little wean them off of the conventional treatment and increase the CBD, THC, the different ratios, etc. That's how I've been managing patients since 2016 in Florida, to get people off of 42 to 58 pills a day, which was the first paper that I published in 2019. How I weaned the patient off of that many pills per day to just the use of CBD with some THC. So that's how we address chronic pain. And pain is the number one reason why people come to my medical cannabis practice, because they don't want to be on the narcotics. They don't want to be hooked. They don't want to be on the antidepressants or anti-anxiety medications, which have so many adverse and side effects.
Yeah, and it really makes me very sad when I think about those who have passed away from overdosing on opioids, because many times when you look at those patients, they're patients who really had legitimate surgeries. They had a hip replacement, they had a knee replacement, and they're just continuing on medication that shouldn't even be refilled by our colleagues. After a certain point, those medications shouldn't even be used. So that's something that is really important, that we message you out there. If you have family members, friends, grandma, grandpas, they've had a surgery a year ago, they shouldn't still be taking those sort of medications that are narcotics that have a high potential for overdose and addiction. So,
And I'm sorry to interrupt, but you just made a very, very good point, that narcotics work well in a specific time frame, right, which is for acute pain, as we discussed, for 3 months, because beyond 3 months, opiates or narcotics cause a hypersensitivity it potentiates their pain. And so after a certain point, like you just stated, it doesn't help with your pain any longer. Now all you are is dependent and eventually can become addicted if not taking, not being conscious.
Absolutely, absolutely. So let's move on to some other types of pain.
The next most common and frequent pain seen many times with patients with like low vitamin B12, low vitamin B9, but also patients with diabetes, which is neuropathic pain. This is pain that's caused by it's some type of trauma or damage to the nerve, but also seen in patients that have shingles or get shingles. And the topical creams for patients with shingles is phenomenal because the way shingles attacks the human body is that it works along a specific nerve. So it's in medical terminology, it's called a dermatome, where a specific area is innervated or supplied by a specific nerve. And when you get shingles, it attacks a specific nerve. And so by using the topical cream, because there are cannabinoid receptors on the skin, by using the topical, it's able to be absorbed through the skin. And with the skin being the largest organ in our body, it's being absorbed, working with our receptors, and it helps address that pain, that neuropathic pain or nerve pain.
My mom had shingles, and it was the worst pain, she said, ever in her life, ever. And I just wish I knew about CBD topicals. I wish I knew about cannabis back then, because that would absolutely, because nothing they used helped her pain. Nothing.
And somebody just wrote, which makes perfect sense because it's one of the qualifying conditions in the state of Florida, which is multiple sclerosis. The pain associated with multiple sclerosis is a neuropathic pain. It's a nerve pain.
Thank you so much. Thank you, Erica. Yes, one of our distributors is living and has really conquered multiple sclerosis. She's gotten a lot of relief from our products, and we'll hear from her a little later. But let's talk about the next type of pain. We've talked about acute, chronic, neuropathic.
The next is nociceptive. Now, that's a big word. What does that mean?
It's a big word.
It's a big word. That's a Sunday word, as we say. Nociceptive pain is a pain that's caused to specifically musculoskeletal. So it can be your joints, your muscles, your skin, your tendons, bones, the broken bone, etc. The example I gave at the beginning, hammering your thumb, an automobile accident. This is nociceptive type pain, which is a pain that affects, can be sharp, can be dull, can be achy. It's the type of pain that is all inclusive. And this is a type of pain that, again, is more muscular and skeletal in its origin. And it is affected by starting with an acute pain, becoming chronic, and then it goes on and becomes a nociceptive type of pain, which falls under the umbrella of chronic pain.
Got it. So would that be something that happens in chronic overuse when you're working out, overuse of you're doing 1 million push-ups and you're having now like a rotator cuff sort of pain, injury, as well as probably it could be nerve injury as well.
Right. Well, nerve injury, you're going to get more of a neuropathic pain. Nociceptive pain is not so much neurological in origin, but more organic, more musculoskeletal. Okay. Not to be confused. And neuropathic pain should not be confused with the next type of pain that we're going to talk about, which is radicular pain or radiating pain. And the most common example of radicular or radiating pain is sciatica, that back pain, that nagging pain that you get or can get in your low back area, and you feel it radiating through your butt cheek, into the back of your thigh, into your calf, and all the way into your foot. That is radiating or radicular pain. It can also happen from a lesion or trauma in your neck. And it's usually because there's a disc that has herniated, it's bulging. And the best imaginary picture to have is, imagine a jelly donut. And you have a jelly donut, you've got the donut on the outside and then the jelly in the center. And if you squeeze that jelly donut on one side or another, that jelly inside is going to move one way or another. As long as it stays contained, you're fine. Once that jelly starts bulging on the wall and making kind of like a balloon and pushing out, that can then cause pressure on the nerve root. And that nerve root then will be blocked by that pressure or inflammation of that disc. And that's then is going to be reflected by having that pain going down your leg or your arm if the lesion is in your neck.
Wow, I had bad sciatica when I was pregnant with my daughter. It's awful.
It's very common in pregnant women.
Very common in pregnant women. I couldn't walk. It's just very, very uncomfortable. So great. So we've got acute, chronic, neuropathic, nociceptive, and radicular. I call it ridiculous. That's ridiculous pain. Any other type of pains?
Well, those are the main ones. Now you can have subchronic pain, you can have subacute pain. In the radicular pain or the neuropathic pain can be, it can be intermittent, meaning it comes and goes. It can be constant. Some people live with constant pain, which are your fibromyalgia patients. They have an underlying pain that's present all the time. And then if there's a change in climate, right now in Central Florida, we have been bombarded with rain over the past, since the weekend. So with the high level of humidity and the dampness in the air, we've been seeing a lot of fibromyalgia flare-ups with a lot of our patients for that reason, because of the change in climate. But also stress can cause it to go up. It's very variable. So you have a constant state of pain. You're in a constant state of pain that's chronic, and then certain things can make it worse, but and more intense.
Got it. So if you want to put in the chat what type of pain you have. Out of all the things we talked about, that would be kind of interesting just to see if our attendees have a clear understanding of what type of pain they have. So let's move on to our consumption of CBD cannabis. Mm-hmm. And let's talk about the different ways that we can consume CBD cannabis to address our pain. And then after that, we're going to, I see a lot of acutes. I've got some chronics. We've got some fibromyalgia sufferers on the line as well. And then we'll talk about how do you consume CBD cannabis for pain. We'll talk about our relief pack.
Perfect. So I'm a big advocate and proponent of mixing and matching.
I am too. We call it layering here at Wakana. I like mixing and matching. Yes.
Because the way we ingest the medicine will determine how quickly we begin to experience the relief from the medicine. So the fastest mode of administration, which unfortunately Wakana doesn't have yet, but maybe your scientists will consider this, and that is the suppository. That is the fastest way.
Did you guys hear that? We got to get a suppository.
Why is it the fastest? It's 52% faster than inhalation. And the reason why is because it's absorbed directly into the bloodstream and it bypasses the liver. So there's no first pass metabolism. What That means is anything that you ingest through your mouth has to be metabolized in the liver. It goes to the liver, and by going to the liver, it's broken down, and from there, it makes its way into the bloodstream. Now, by using it in a suppository, you bypass the liver, so 100% of what you've ingested is going to make its way to the cannabinoid receptors. So that is the fastest mode of administration, which is why in conventional medicine, for those of us that have managed pediatric patients, when a child has a seizure and you want to break that seizure, the best way to manage it is giving them an intrarectal benzodiazepine. You give them Ativan, you give them, whether it's lorazepam, clonazepam, anything that ends in zapam is available intrarectally. So if a child is having a seizure, they're not going to be able to swallow any medication. So you give them the medication intrarectally. And so for that reason, that is a viable mode of administration. However, not too many people are comfortable doing that, and not too many companies have a product that can fall within that capacity. So the next fastest mode of administration is inhalation. Inhalation, the most common form of inhalation is smoking. You get your flower, you grind it, and you combust it, or the way I like to use flower is in a dry vape. I dry vape, which means I have a handheld vaporizer and I grind my flour. And for those of you that are old enough to remember your easy bake ovens, how did you make those nasty ass cakes and pies? You didn't use flour. There was no combustion. It was a freaking light bulb. And then there was a button that you controlled the temperature setting on the light bulb. And so the lower the temperature setting, the less heat the light bulb put out. And the higher you turn that knob, the greater the heat was generated by that light bulb. Well, it's the same concept in this handheld vaporizer. You can control the temperature setting on this handheld vaporizer. And because this is chemistry, people, every phytocannabinoid has a different vaporization point. They vaporize at different temperatures. So by using a lower temperature setting, you're going to be able to extract and utilize more of the acids, the CBDA, the CBGA, get your acid form, and then at a higher temperature, then you're going to be converting those CBDAs and CBGAs. They're going to decarboxylate, losing that acid, and then becoming the CBGs and the CBDs. And for those that are in legal medical states, the THCA going to THC. So those are different modes of administration. And so I like to use that dry vape to get my flower. Another form of inhalation is using your electronic cigarette, using a concentrated oil that you connect to a battery and engage in your inhalation that way. So you've got inhalation. Now in the state of Florida, we have one dispensary that has a nasal spray. And in that
we have a nasal spray too.
And so by using that nasal spray, it's great for those parents that have children with epilepsy. So rather than dropping their pants and their underwear and then flipping them over and giving them the benzo intrarectally or in the mode into the rectum, you can just squirt the spray into the nose. That's going to it's going to go straight into the brain where you have the CB1, CB2 receptors found in the brain, and it immediately works at that capacity. Another mode of administration with inhalation are your meter dose inhalers, which another idea for Wakana that you guys don't have yet is to use it in like a regular inhaler. Why? Because a lot of patients think, okay, and we had a CEO of one of the dispensaries here say, smoking your medicine is an oxymoron. And I'm like, really? It's like, I've had asthma since I was a child. And since I was 11, I've been using albuterol as an inhaler. And then I've graduated because, of course, you know, as an adolescent and a young adult, we abuse the hell of our bodies because we think we're going to live forever. And, you know, in 3 months, I'm going to turn 60. So I definitely want to live forever.
You look amazing. Yeah.
So do you, because you and me are the same age,
We're
baby.
the same age. Yes.
I'm just a few months older than you. But using that meter dose inhaler it's an easier sell for individuals that have issues with their lungs, because the first thing the patients are going to give you, or the first pushback you're going to get is, oh, my doctor told me I can't smoke, or my doctor told me I cannot inhale or use an electronic cigarette. But if you have it in a meter dose inhaler, there's no argument there. They're getting their medicine. They're getting the medicine in a way that they are familiar with. And our colleagues that are not advocates like you and I, they're going to have to stick their tongue somewhere where the sun don't shine. So that's so those are three, you know, different modes of inhalation. Whether you're combusting your flower, combustion means lighting it. The next would be your inhalation with your oils. Next would be a nasal spray, and next would be your meter dose inhaler. So that's your inhalation. That starts to work within 3 to 10 minutes. So you get the effect of the medicine within 3 to 10 minutes. The disadvantage is that it only lasts 2 to 4 hours, which is why you want to do the layering. So in conjunction with the inhalation, you want to use the tinctures under the tongue. Why? Because that's the next fastest mode of administration. There's a rich vascular means blood supply. There's a rich vascular bed underneath the tongue. And by putting that oil under the tongue and letting it sit there for 45 to 60 seconds, it's absorbed. And then I recommend that you swish it through your mouth, so that way you're stimulating all the receptors in your mouth, your tongue, under your tongue, the roof of your soft palate, hard palate. And then you go ahead and swallow it. You're going to get the effect of that within 30 to 90 minutes. So it's the next level of the tier, or the layering. And that's going to last about 4 to 6 hours. So you got the inhalation that's going to be good for 2 to 4 hours. You've got the tincture under your tongue for 4 to 6 hours. And then the next phase would be the oral ingestion, whether it's a gummy or an edible gummy, chocolate, or an actual capsule or a gel cap. By going into that next phase, that can take up to 2 hours for you to feel the effect of ingesting it orally. And as I mentioned earlier, it's going to be metabolized in the liver. So with an oral ingestion, you want to be mindful of your medications, because you can have what's called a drug-drug interaction. The CBD is metabolized the same way as your other medications are metabolized in the liver. And the liver is lazy. It's going to go through the path of least resistance. And CBD tends to have an effect on the cascade, the cytochrome P450 enzymes that are what metabolize our medications. And so by ingesting both at the same time, you may not be able to absorb them appropriately. So in that situation only, I encourage patients to offset their medication, conventional medicine, with their CBD. And that is, take it an hour and a half before or an hour and a half after. So that way there's no conflict between your cannabis and your regular medications.
Mhm. Wonderful. Can you repeat the swish, swish? Everybody likes that. So you're putting it under your tongue and...
So what I do personally and recommend my patients to do is whatever the amount is, I'm going to put under my tongue, whether it's the 3 drops that is recommended with the pack, because you have multiple tinctures that you recommend to use under the tongue. So you put all of those drops under your tongue and you let it sit in your mouth for 45 to 60 seconds. By having that in your mouth, your salivary glands are going to be producing saliva, spit, for those of you that didn't go to medical school. So you're gonna have a lot of spit in your mouth, and that spit, saliva, in conjunction with these oils are going to be sitting there. And so while you're waiting, you just start swishing it like it's, Listerine. You're just moving it around your mouth, making sure that it hits every corner of your mouth, under your tongue, the roof of your mouth, because you have receptors all in there. And then after you've done that for, a minute or two, then you go ahead and swallow it. And now it starts the whole stimulation and of the endocannabinoid system. And then the process is working beautifully.
Fantastic.
And then last but not least, we've got the topicals. And topicals is anything that you apply on the skin. So it can be a cream, it can be a gel, it can be the tinctures that you put under your tongue. You can take that same tincture and put it on your wrist or on your elbow for any type of joint pain. You can also rub it on your hands if you're having that neuropathic pain, like you're a diabetic and you have diabetic neuropathy. You can rub it on your hands. You could rub it on the soles of your feet if you have the neuropathy in your feet. For example, I've got 4 grandchildren, and when my daughters were calling me and telling me, they're not sleeping, Dad, we're having a hard time. I'm like, baby, just grab some of that CBD oil, mix it with like lavender oil. So you get some CBD with lavender. Lavender has a terpene that's called linalool, and it causes a sense of calm, a sense of peace. So you mix some CBD oil with some of that lavender oil, rub it on the palms of their hands and the soles of their feet. That's it. You're gonna knock them out. And it's CBD. There's no euphoria, and they're gonna fall right asleep. And so that's worked great for my grandkids, and I recommend that a lot to my parents and of my pediatric patients.
I love that. My mom would put wine in our bottles back in the 60s. Now we can take a little bit of CBD and lavender and really help our babies, right? Our grandbabies. I don't have any grandbabies. I have a grandpuppy, but not yet. Wow. Great information. Great information. Great.
Now, there's one more mode of administration that's very uncommonly known, and this I borrowed from my Indian friends, my Hindu, that practice Ayurvedic medicine. And it is the Pakoti method or Pachodi, depending whether you're on this side of the pond or that side of the pond. But it's spelled P as in Paul, E, C as in Charlie, H, O, T as in Tom, I. Pachodi or Pakoti. Are you familiar with that one?
I am not.
This would be great for your moms, your expecting mothers. And the way to use this is you would put those same 3 drops that you talk about putting under the tongue.
Yes.
Putting it inside the belly button. You put it inside the belly button, and then you rub it in within the belly button, and then 1 inch around the belly button, all the way around. There are vessels there that cause an absorption, and by being absorbed, it goes right into the bloodstream. And in Ayurvedic medicine, they utilize different oils to treat different things. So menstrual cramps are treated that way by using a certain type of oil. They talk about using almond oil, peanut oil, cashew oils, all kinds of different oils for different types of ailments and conditions by utilizing that method.
Fantastic. Wow. Did you guys get all of these nuggets? I'm glad this is a recorded line, because this is great information as we build. I mean, we all love the swish. I'm going to start teaching the swish. We're going to activate all those receptors in our tongue, under our tongue, the roof of our mouth. This is really good. So Dr. Joseph, let's go through this relief pack with everyone.
All right, let's do it.
Let's do it. So you know that we always start with our disclaimer. Just know that we're going to go through the products in this relief pack, and these statements made regarding these products have not been evaluated by the Food and Drug Administration. Um, just know that you need to consult with your physician. If you're pregnant, if you're nursing, this is the way we get to loop in our medical practitioners, our healthcare practitioners, right? We can do this in a very sneaky way by letting them know that we want to take CBD and we want to get their approval. Now, 9 times out of 10, they may not know anything about CBD or cannabis, and that's why you're going to send them my way so I can empower them and educate them. But the FDA requires that we state these things. If you're new on the line, I just want you to know that Wakana is the name of our company. We are founded by 4 African-American women. We are the crown jewel of CBD, and we want to, again, welcome you tonight. We're going to take questions at the end, but just know that our products are tested. We partnered with Green Scientific, which is in Davies, Florida, about 2.5 years ago. They do our certificates of analysis. They do all of our testing to ensure our products have the legal limit of THC, which is 0.3% or less, if it's a full spectrum product, ensuring that our products are free from mold, mildew, heavy metals, pesticides, residual solvents, ensuring that the terpenes are there, and again, the potency that's on the bottle is really what's in the bottle. So I want to briefly go through, because I want to have time for questions. I know you have questions for Dr. Joseph Rosado. Our relief pack. Our relief pack is amazing because it really addresses all of those types of pain that we talked about this evening. It includes our black seed oil. You know, black seed oil is like that super essential oils. It really helps to reduce inflammation. It's good for so many other things like digestion, kidney function, liver function, cholesterol, hair growth, you name it. It is amazing. So black seed is intentionally put in this package because it does help to reduce inflammation. Also in the package is our power gummies. This is our full spectrum gummy. Again, CBD in any form addresses inflammation. It is a potent analgesic. It is the most powerful pain medication that's natural and holistic and from God's earth. So these power gummies are 25 milligrams each. This is a great gummy that you can take at night. You can take it to help you not only sleep, but not have to wake up in the middle of the night with pain. So using a half to 1 gummy a night is great. And then our broad spectrum gummy. These are gummies I take during the day. These gummies contain less than 0.0% of THC. Broad spectrum or our pure products are great products for those who have random drug screens, and they don't have to be worried about failing those drug screens. Each gummy is 60 milligrams, and I'll give you my formula at the end. I like using these during the day. You can use them at night to help to sleep, as well as reducing inflammation. And then our liquid relief. This is Dr. Rita's Rub, Dr. Joseph. This is coined Dr. Rita's Rub. This is an amazing topical that is enhanced with 6 essential oils that help reduce inflammation, enhances the CBD benefits. But I love the fact that you just rollerball it on and you keep it moving. So I keep this in my bag and carry it with me at all times. Now, this is a tincture that we're going to start swishing. Swish, swish, swish is what we're going to call it. This is our Pranium 500 milligrams, our #1 tincture. It is something you're going to use twice a day. You're going to use it in the morning, in the evening. Start low, go slow. 3 drops is a great, great way to start this tincture. And then our other topical, our Extreme Power Pain Cream, I like using this at night because I like to let it really settle in to the tissue, to the muscles, to the joint. So when I'm sleeping, I utilize the Extreme Power Pain Cream. So this is my recommended usage, right? We talked about layering. We talked about when one kicks in and the other one has stopped working, you have a continuous equal level working plane of CBD in your system. We want it to continuously be working during the day, during the afternoon, at night. So in the morning, 3 drops of the hempranium, 500 milligrams under the tongue, 3 drops of black seed under the tongue, swish, 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 all around. Don't swallow until about 60 seconds, letting those glands really absorb the CBD. Midday, I do a broad spectrum gummy. The liquid relief, like I said, I'm carrying it around everywhere. I work out every day, so I'm able to just rollerball it as needed every 1 to 2 hours. And then at night, I was typing too fast. At night, this is the regimen: 500 milligram tincture, 3 drops under the tongue at night, as well as a half to 1 whole power gummy, 30 to 60 minutes before bedtime, and then apply to the affected area the extreme power pain cream. Now, this is a great package for those that we know, and even ourselves, that have acute, chronic, neuropathic pain, nociceptive pain, radicular pain, all of those different type of pains we talked about. This is something that you can utilize to assist. And what is so great about this package is the savings. You get to save over $113 when you purchase it in this package versus a la carte. So you want to order your relief pack. Please connect with the person that invited you tonight so you can get your package. You can get that in your hands and you can start to utilize it. So we're going to take some questions. We have a couple of minutes. Put your questions in the chat there. We have some members of our medical advisory board, Dr. Betty and Erica Zachary. They are on the line as panels. You can unmute your mic, that's right, and ask any questions that you may have. We have one question. What are the suggested products for knee pain from an injury? So for knee pain from the injury, I would utilize that relief pack and the recommended way that I talked about, using the tincture twice a day, morning and night, using that black seed as well in the morning, utilizing the broad spectrum in the afternoon. You've got the topical that you're using as a roller ball on those knees, and at night, tincture, the gummies, and the cream. Utilizing these products, layering it is what's so important. We can't stress enough, diet. If you have a poor diet and you're using these amazing, incredible products, it's all for naught, right? Making sure your diet is rich in fruits and vegetables, not fried food, processed food, right, Dr. Joseph? All of those foods that are fried, processed in bags and packages are inflammatory triggers. We want to make sure that if you have knee injury, knee pain, that you're losing weight, right? That weight on those knees even makes that pain worse. So, you want to add anything else, Dr. Joseph?
Nope, you covered it beautifully.
What are the recommendations for plantar fasciitis? Oh my goodness, I had plantar fasciitis. I think last year, you guys remember how I was utilizing the products. I was doing my exercises. There's some exercises you do for plantar fasciitis. I worked on that with our products, with our tincture, with our topicals, with our gummies, this same relief pack. We didn't have it then, but I used these same products, and that plantar fasciitis left me within a month. So yes, these products, Rita, you want to use for plantar fasciitis. Dr. Betty, Erica Zachary, did you want to chime in? We're 1 minute after 9. We're going to close it up very soon.
Hey, I just want to say thank you. So thank you so much, Dr. Rosario. That was awesome. I am going to go buy me 2 relief packs tonight for myself. But thank you for the swish, because I'll be doing that tonight as well. I'll be thinking about you when I'm swishing, and I'll be putting the lavender, because I ran out of gummies. I'm like, oh my God, I don't have any nighttime gummies. And so I'll be putting my CBD cream on my feet, which I don't normally do at night. But I have some lavender oil here too. So I'll be adding that to my feet as well. So, but thank you so much. Thank you so much.
You're welcome, ma'am.
Thank you, Erica. Erica has been doing very well. Dr. Joseph Rosado, she has multiple sclerosis and has done amazing with her weight. You're down how much now?
56 pounds.
She's down 56
56
pounds.
pounds. Yeah, I'm 4 pounds away from my ultimate goal. I've made it into the healthy weight range for BMI, but I want to lose 4 more pounds and then just keep it there.
Congratulations, Erica. Great.
Thank you. Thank you.
Thank you.
I feel great. I feel great.
You look great too.
Thank you so much.
Fantastic. Any other questions? Great questions from the audience. My guy has severe spinal stenosis with a titanium plate that is moving into his spinal column. What do you recommend? He has constant neck pain and headaches.
So again, a good place to apply the oil would be in the upper cervical area and the upper neck area, because all nerve transmission has to pass through that upper cervical region to send the messages to the brain, and then messages from the brain to the rest of the body has to all occur there. Just imagine that you've got 2 train tracks, one on either side of your spine, sending information up to your brain. And so by applying this, the topicals, whether it's the oil or the cream, to the neck area, but particularly in the upper neck area, is phenomenal for that type of pain. Also, for the headaches, you may want to apply them in your temples, over the temporal area, because you have some blood vessels right here, the temporal artery. And by applying it there, it's absorbed through the skin and into the blood vessel, and that'll make its way throughout the body. So those are different areas to apply for pain, head and neck.
Fantastic. You know, I want to remind you again, thank you, Dr. Rosado. I used to teach about a year ago that yes, you guys can use the tincture topically. Absolutely, you can use your tincture topically. The question is, can we use the black seed oil in the belly button as well? Absolutely.
Any type of oil can be utilized in that Picotti method, because as I mentioned in the conversation, in Ayurvedic medicine, they utilize different types of oils for different types of conditions and ailments. So you may want to research, Picotti method, and then there's an actual chart that shows, ailment, the oils, and then what oils work on what specific ailments.
I'm definitely going to check that out. That's great information. Excellent.
And what do you have for babies like this?
We don't have anything yet. We're working toward it. We're working toward our CBD for your babies. How
you just made her cry.
Sorry.
All her treats are hemp based.
I know. We're very close. We're getting there. We're gonna have hemp based treats and everything for dogs and cats. What type of dog is that?
It's a Pomeranian.
Oh, beautiful. Beautiful. Well, we want to thank.
Can I ask another quick question before we let off?
Yes.
So Dr. Rosado, really quickly, so I'm licensed in Maryland and Maryland where I live, but also in Florida. And I have 2 clients right now that are looking for a physician that is okay with cannabis. And so do you have a practice there that I can maybe refer them to? I know you're in Florida.
Yeah, I am in Florida. However, at this point in time, the only medicine I practice is medical cannabis, part-time Friday afternoons and Saturday morning. My day job is as medical director. So I oversee 15 providers their medical assistants, all front desk staff, referral departments, quality control, quality assurance. So I have about 50 people under my watch. So I'm too busy to see
Sure.
patients on a day-to-day primary care basis. However,
You
I
have a
have
recommendation?
I have a strong group of providers. If they are in the Central Florida area, I can certainly refer them to any one of my colleagues, or, depending on what part of the state, I can certainly support them. And I saw a question regarding the spelling on the Picoti method. I'll spell that again. So get your pens and papers out for those of you that are old school like me and still use a pen and a paper. It's spelled P as in Paul, E, C as in Charlie, H, O, T as in Tom, I. Picoti method or Picoti method, whichever.
Tell it one more time.
Sure. P as in Paul, E, C as in Charlie, H, O, T as in Thomas, I.
There you go. Is that right?
That's it.
Wonderful. I'm going to definitely research that. Well, thank you so much, Dr. Joseph Rosado. I can't talk. Let's give it up for him. Yes, put it in the chat how awesome tonight was. We talked about pain, 5 different types of pain. We talked about the different methods of consuming cannabis, CBD. We talked about swish. Every time we use tincture now, we're going to think of Dr. Joseph Rosado. Thank you so much. Belly buttons. Every time we put oil in our belly button, we're going to think of Dr. Joseph Rosado.
Now you're going to get freaky. Watch it.
What? I know. Sorry.
You're going to get freaky.
And the bottom of the feet.
We want to thank.
Yes. So I just want to say thank you very much. You have left me speechless. Dr. Rita knows I always have to get my 2 cents in at the end about the holistic, but you covered it all. Thank you very much.
Yes, he did, didn't he? Well, wonderful. So I thought I was going to see you soon in June. Maybe I may be speaking at the Premier Hair Show in Orlando. About hair loss, because we have some amazing products that address alopecia. So I'll see you soon.
When in June?
I think it's June, 2nd week in June, 10th or 11th.
Okay, because my birthday is right after Father's Day. My birthday is June 24th. So if you're down here, we'll do it up big for my 60th.
Yes, let's go. Let's give it up for Dr. Joseph Rosado. Thank you so much.
Thank you. Dr. Rita, please get the information from me, please, about his contact. Thank you.
Yes. Oh.
Yes.
Can you just spend 2 minutes, 2 seconds on your book? You forgot to tell them about your book.
Sure. My book was published in 2019. 4/20/2019 was when I published my book. That was not a coincidence. It's entitled Hope in Healing, The Case for Cannabis. it is an Amazon bestseller. So what you want to do is go to Amazon and do an author search with my, on my name. So Joseph Rosado, R-O-S as in Sam, A-D as in David O, Joseph Rosado, and it'll populate, and it'll have a green cover, and you'll see it. It'll read Hope in Healing, The Case for Cannabis. It's also available on Kindle. It's also available in Spanish. So it's in English, in Spanish, hardcover, paperback, and Kindle. It's not on audio yet because when I was getting ready to record it, we had a pandemic and all the studios were closed. So I was unable to record my book in the 2 languages that it exists right now. Hope in Healing, yep. Hope in Healing, The Case for Cannabis.
Oh, The Case.
Yeah, The Case for Cannabis. And then if any of you want to get a hold of me, you want to shoot me an email, my email address is info@JosephRosadoMD. info@JosephRosadoMD. And my website is josephrosadomd.com. I'm also on Facebook, Instagram, LinkedIn. So just search my name and you will find me.
Is that right? Info@JosephRosadoMD.com. That's your email.
That's my email address, yes. And then my website is josephrosadomd.com.
Okay, Joseph RosadoMD.com.
Yes, ma'am.
Hopefully that's right. I don't have my glasses on.
You did well.
Yes.
It's
Well,
that
that
CBD. It's helping your
That
eyes.
near 60. Yes. Well, have a good night, everyone. Thank you again, Dr. Joseph Rosado. Thank you, Erica Zachary. Thank you, Dr. Betty. Thank you, all of our guests, all of our business partners. If you're a guest on the line, connect with the person that invited you. Order your relief pack. If you're a distributor on the line, order your relief pack. Just order your relief pack because you
That's
need
it.
it. Have a good night. Be well. Be safe.
Bye.
God bless.
You
Thank
too. Bye-bye.